my next guest. I think now in the age of COVID, the organization that she works for brings in some really amazing information and resources. So if you'll join me in welcoming Laurie-Marie Pisciotta from the Mental Health Association of Rhode Island.
Good
Hi,
morning.
Laurie-Marie.
Good morning, everyone. Thank you, Deb, for this opportunity. It's really great to be here.
Yeah, I'm so glad. You're a little jumpy, so I think that's probably because of the storm yesterday. It's kind of made everybody's internet a little hiccupy. So don't worry. We're just going to keep on going. So tell everyone about the Mental Health Association Rhode Island. What is it? What do you do?
Sure. The Mental Health Association of Rhode Island is over 100 years old. We were founded during the time of when people with mental illnesses were often forced to live in what used to be called asylums. And our organization was formed to create positive change in those asylums and in the general mental health care system. We're part of a national umbrella group. So there are many mental health associations in many states. And what we do is we focus on, again, systemic change in the mental health care system.
Oh, and we lost Laurie. Oh my goodness. See, and this is what happens when you're running live stream events after a hurricane has come through. All of a sudden, it's like, ooh, pink sound. Somebody just pops right off. So here we are with Laurie again.
Sorry about that.
That's okay. Yeah, I was just saying that happens after the hurricane when everything's unstable, but the show must go on. So I cut off at systemic changes.
Yes, so we focus on improving the entire mental health care system in the state of Rhode Island, from the outpatient levels of care, for example, therapists and psychiatrists, and increasing access to them through health insurance coverage, including Medicaid and Medicare, through the higher levels of care, and addressing the social determinants of health, like housing, and access to medical care, to improve the quality of lives for all Rhode Islanders.
Oh, that's awesome. So when you say across the continuum of care, I know one of the things that has really kind of changed with COVID is telehealth. How effective has that been? Are you seeing, coverage for that? Is it being used? What are your experiences with that?
Yes, there are, in Rhode Island, we have executive orders from Governor Raimondo that require health insurers to cover telemedicine for most kinds of visits that you would normally have in person at a doctor's office. And that includes therapy and psychiatry, as well as many other medical practices. So for example, I saw my primary care doctor in a telemedicine appointment when the pandemic first hit. Many specialists like cardiologists are offering telemedicine as well, because this allows patients to access the care that they need without having to put themselves at risk by going into a doctor's office where there might be COVID-19 germs. Providers in the behavioral health community have had a very positive experience with telemedicine. It's increased access to treatment for many Rhode Islanders who don't have access to easy transportation,
That's
or
awesome.
childcare, or perhaps adults who are caring for their parents. So it's increased access to care because people don't have to leave their homes. It's very convenient. So that executive order is still in place in the state of Rhode Island. And Mental Health Association is one of a number of nonprofit organizations advocating to keep telemedicine permanently in Rhode Island, so that Rhode Islanders always have this option, even when the pandemic is over.
Yeah, I totally support that. Absolutely. Because the access to care is so huge. I mean, it's great to have things offered, but if you can't get there, or sometimes people might feel uncomfortable even walking into a mental health treatment facility. And so it allows them to get the support that they need in an environment that they're comfortable in. And I think that that is so critical. Never mind if you have a mobility impairment and the whole transportation system. Do you find is everything covered for mental health services in the same way as if I, say, fell down and broke my arm?
Yes, with mental health services, if you have private insurance, you would still be responsible for cost sharing. Although the governor's executive order has temporarily paused cost sharing because the pandemic has also brought an economic crisis in addition to the medical crisis. Many people are unemployed right now. So for temporarily in Rhode Island, cost sharing has been paused for mental health services. So you're not responsible for your copayment if you have private insurance. If you have Medicaid or Medicare, you do not have a copayment for therapy or psychiatry anyway. So that stays.
Oh, froze again. At least when you're freezing looking good. So that's good. I hope that is something that stays with us. So for the Mental Health Association of Rhode Island, are you a physical building? Do you have an office someplace that people can come in if they need treatment? Why would they reach out to you?
So the best way to get in touch with us is to go to our website, which is www.mhari.org. We have an office space at Butler Hospital, which is a psychiatric hospital. It's a very small office. We don't see people in person because we do not provide direct services. In other words, we do not provide therapy or psychiatry or case management. Because we focus on improving the mental health care system for all Rhode Islanders, much of the work we do is in the community. And so the best way to reach us is to go to our website, and you can either call us or send us an email from our website. We're working on so many different things right now. Things like increasing equal coverage through health insurance, be it Medicaid, Medicare, or private insurance for behavioral health treatment and services, because health insurance companies and Medicaid and Medicare often don't provide adequate treatment for mental health services compared to what they provide on the medical side of a plan. So we're fighting to get equal treatment for people who have mental illness. We're also lobbying at the State House when it is in session. I track about 70 legislative bills per session and testify on a number of them. We also organize the mental health community, providers, other stakeholders, and consumers like me. We organize them so that they can collectively bring their voices together to advocate for change, making calls to their reps and senators at the State House. We have a number of research projects going on where we're collecting data so that we can inform Rhode Island's decision makers about where the gaps are, what needs aren't being addressed with health insurance or with services in the community. I also have a seat on the Health Insurance Advisory Council, and I speak on behalf of the mental health community there. I also have a seat on the Governor's Council of Behavioral Health, and I chair that council's Olmstead Committee. We're trying to get an Olmstead plan in the state of Rhode Island. Almost every other state in our country has an Olmstead plan. Rhode Island is in a very small minority of states who do not. And an Olmstead plan would help us comply with the Americans with Disabilities Act by providing housing options and community services and home-based services that would allow older adults, young people, people with disabilities to stay in their homes and to stay in their communities, as opposed to having to live in institutions like nursing homes or hospitals.
Yep. And just if you could just go back for those people who don't know what the Olmstead Act is, if you could just touch briefly on what it is and why we need it.
Sure, absolutely. Great question. In 1999, the Supreme Court heard a case called Olmstead v. LC, and the Supreme Court ruled in that case that it is a violation of the Americans with Disabilities Act when states do not provide adequate housing and community services and supports to allow people with disabilities, youth, older adults to live in the least restrictive setting possible. So that means that the state is responsible for providing housing options, affordable housing, housing with supports and care and supervision for people with very serious mental illnesses, developmental disabilities, complicated medical histories. The state is responsible for providing community services, community supports, home-based healthcare services, educational opportunities, opportunities for people with disabilities to work in integrated settings like normal jobs in the community, to be gainfully employed as opposed to going to a day program every day. Basically, that people with disabilities, older adults, and youth have the right to be part of our community, to be seen, to be heard, to live a normal, full, rich life, having employment opportunities, educational opportunities, as opposed to living in institutions like hospitals or nursing homes when they don't want to.
Wow. So when the term disability is used in relation to the Olmstead Act, is it individuals with intellectual and developmental disabilities, autism, or is it physical disabilities as well?
It's all disabilities. It's physical disabilities, developmental and intellectual disabilities, as well as very serious mental illness. The kind of mental illness that would prevent someone from being able to live alone and take care of themselves. So the Supreme Court decision, Olmstead, said that people with very serious mental illnesses and other disabilities have the right to live in their communities and not be hidden away in an institution where they cannot live a rich and full life.
Yeah. So Rhode Island, if I'm understanding correctly, Rhode Island still has a ways to go to make this a best case scenario.
Yes, we do have a long way to go to make this aspiration a reality. The Mental Health Association, as I said, we are at the forefront of this fight. I chair this committee on the Governor's Council of Behavioral Health. We are publishing 3 editorials in the Providence Journal over the next several months that will educate the public about what an Olmstead plan could do for the state of Rhode Island and why we need one here. And we'll also be having virtual town hall meetings to discuss an Olmstead plan from the perspective of the people that it would help, also from the perspective of states that have Olmstead plans, to talk about how they got an Olmstead plan in their state, how they funded it. And also talking about specifically the fact that in Rhode Island, as in many states, our prison is technically the largest psychiatric institution in the state, because we have about 400 to 500 individuals currently incarcerated who are incarcerated because they have serious mental illness that prevents them from being able to take care of themselves, but we don't have the housing options for them and community support services. So then they are left to be homeless, living on the streets. And that's where they have contact with the criminal justice system because of symptoms of their mental illness, and they become incarcerated. And then, we have, as I said, 400 to 500 people living in the Department of Corrections Adult Correctional Institute right now who are there because of mental illness. So
Wow.
you'll be hearing a lot from us in the next several months as we start to build momentum for getting an Olmstead plan in the state of Rhode Island.
Yeah,
You can sign up for our newsletter if you want to be kept apprised of those events.
so if somebody wanted to sign up for your newsletter, where would they find that?
On our website, www.mhari.org. And for those of you who like Facebook, we're also on Facebook, and we distribute a lot of resources and good information, information from other organizations doing similar work, like rielderinfo. We promote you all on Facebook. So if you subscribe to the Mental Health Association's Facebook page, you'll learn a lot about what's going on in the community as a whole, because we tend to collaborate with a lot of other nonprofits.
That's great. I think, in today's budget, it's really important that nonprofits work together, because the funding streams are really pretty small. So how do you guys get funded?
Great question. Thank you for asking. So we have a service contract with the Department of Behavioral Health, Developmental Disabilities, and Hospitals to provide public education programming, our parity initiative, and that community organizing work. Our research projects are funded by that. We also have funding from the Rhode Island Foundation, and individual contributions from people like us.
Wow. So if people wanted to donate, can they find that donation information on the website as well?
Absolutely. There is a button on our homepage that says donate.
Yep.
And we also have a page that describes other ways that people can give. We would, gladly welcome a donation of time or in-kind gifts if you're not able to make a financial contribution. You can also fundraise for us on your own Facebook page. You could ask people to, people in your social network to give to the Mental Health Association as well.
Awesome. So that sounds like there's a lot of different things that are going on. And wow, in the age of COVID, we really are seeing depression and anxiety just spike through the roof. And so if someone noticed that they were feeling depressed or anxious, what should their first steps be?
Great question. If you notice that you yourself are feeling depressed, and symptoms of depression are not always obvious, it's not always someone who is crying a lot. Symptoms of depression include changes in sleeping behavior, sleeping too much or having difficulty sleeping, changes in your appetite, maybe loss of appetite or an increased appetite, loss of interest in activities you would normally enjoy, the inability to feel pleasure, the inability to feel a full spectrum of emotions, social isolation, substance use. So if you notice these symptoms in yourself or a loved one or a friend, I would reach out to schedule an appointment with a licensed therapist. There are many ways to find a licensed therapist. First, you can start with your insurance network. That's usually information you can find on your insurance website, whether it's Medicaid, Medicare, or a private insurance company. You can start with the website. You can also call the number on the back of your insurance card and ask the representative to give you a list of therapists in your geographic area. There's also the ZenCare website, which has a number of providers you can find in the state of Rhode Island. And you can also see a little introductory video by each of those providers if you wanted to get a sense of who they are before meeting them. If someone is in crisis, if it's a life-threatening crisis, you can call, of course, 911. If it's not a life-threatening crisis, but it is a very serious situation, for adults, you can call BH Link, which is local to Rhode Island. They have a 24/7 hotline number that you can call. And for kids, there's also Kids Link, which again, 24/7 hotline that you can call for someone who's experiencing a very serious situation. Those are the two best resources I can think of for emergencies.
That's awesome. Absolutely awesome. Hold on one second, and I am going to see if I can get that information up on, oh, there's BH Link. Good. And you said it was Zen Care, and they can find doctors there and kind of do almost like a virtual interview, or at least see the video to kind of get an idea if you click with your doctor. And I think something that's important for people to understand is if you have tried reaching out to a doctor, and maybe you're seeing a therapist, and you're not clicking with them, that's okay. You can tell them that, and they'll work to find you someone that you can kind of connect better with. And it's important that people realize that it's not a one size fits all. Everybody has their own personalities. We like some people and not other people. So
yeah, that's absolutely right. I would say that therapists are like shoes, and sometimes you have to try on a few pairs before you find the one that's the right fit. And,
yes.
and that's normal. That's normal. That's nothing to be embarrassed about. That's typically how it is.
Oh, this has been great, Laurie. I'm really glad that you were able to join me today, even though it's a little, technical glitches. That's real life, and these things happen. But I'm really glad you were able to join us today. And I look forward to working with you and supporting what you're doing in the future. So please, I know we'll be talking to each other again.
Thank you very much. Thank you very much. I wish everyone well. Stay well.
Thank you.